So just a year ago, since I became Premier, we set out to achieve a number of initiatives by taking a collaborative approach to issues of concern from Manitobans. We've accomplished much in the last year, but of course there is still much more work to be done. Manitoba is the home of hope and opportunity. The future is bright for our children and our grandchildren as we continue to make the bold changes necessary to ensure, as they grow, they choose to call Manitoba home. Today, we set out a course of action for our government for the next year. I believe Manitobans want to see firm commitments that help build strong and safe communities, have access to strong, reliable health care, and make life more affordable in these challenging financial times. The throne speech outlines several initiatives we know will help us reach those goals for the benefit of all Manitobans. To make neighbourhoods across the province safer, we will support law enforcement with training, new technology, and additional officers. At the same time, we will work relentlessly to improve circumstances of homelessness, addictions, and mental health challenges in our communities by supporting 1,000 addictions treatment spaces. We will launch the largest investment in generations in our healthcare facilities here in Winnipeg, a multi-year, multi-billion-dollar commitment to go alongside the over $800 million in capital investments we have already committed to across the province. We will increase the initial $50 million investment we made in the Manitoba Venture Capital Fund, expand the community's economic development fund, and further support the province's mining industry to attract opportunities and to enable the processing of critical minerals right here at home. These are just a few of the commitments we have made in the throne speech, and over the next weeks and months ahead, there will be even more initiatives announced to make our province a stronger, safer, and more affordable place to live. There are great things happening today in Manitoba and even more on the horizon in the future. It's a great day to be a Manitoban. Thank you, and just open it for any questions that you may have.
Promises you made talks about financially stabilizing Manitoba Hydro. The opposition has promised to somehow have a freeze on rates they haven't provided any details as to how. Wondering if you can provide details on how you will financially stabilize the Crown Corporation.
Well, again, we will come out with the details. This is sort of the visionary side of it. We'll come out with more of the details in terms of what that will look like, but it will be a balanced approach between stabilizing the financial situation of Manitoba Hydro while also providing affordable rates for Manitobans, which is what we're hearing from them.
Now, the utilities and debt, Moody's this spring warned that the debt levels were very high, and that the self-sustainability of Manitoba Hydro was supporting itself through rates was starting to be in question. So is the government going to reduce the amount of money it takes through, loan guarantees or water rentals, that sort of thing?
Again, we will be coming out with the details in the weeks and months ahead with respect to that, but I can tell you we are committed to making sure that we stabilize the financial situation at Manitoba Hydro while also ensuring that rates are affordable for Manitobans.
Can you give us an idea of, talking about capital programs for Winnipeg hospitals, Health Sciences Centre, there's some older buildings there. I mean, would that be one of the big ones?
Yeah, I mean, that's a good example, obviously, of we've all been either in the Health Sciences Centre ourselves or had loved ones in there, neighbors, friends, and we see that parts of it are 100 years old. We need to upgrade these facilities to ensure that they're state-of-the-art, especially for patients, but also for those who work in those facilities to make sure that that we're providing, the best facilities possible.
Could this mean new builds? I mean, you just talked about there's parts that could be renovated and improved, but could we be talking about new builds?
Again, I mean, we will be rolling that out over the course of the next weeks and months ahead. You will know also, I was at the Grace Hospital dinner recently and announced that We will be investing in their ICU there as well. And so those are some of the things that we will be helping with. But again, the details of that will come over the course of the next little while.
On crime, there's something here about a renewed and enhanced camera network system.
Mm-hmm.
Is that new cameras or more cameras downtown?
So again, the details will be, we want to work collaboratively with municipalities. We want to make sure that we're talking to police officers and getting their input in all of this. And so again, more details to come on those. But I think it is obviously what we want to do is create a safer community for for families in downtown Winnipeg.
So are you talking about increasing the surveillance in downtown Winnipeg? Is that what Winnipeggers can expect?
Yes, I think we are looking at what will that look like. Obviously not wanting to invade in people's privacy and so on, but we need to ensure that we're catching the criminals who are out there, that are preying on vulnerable people in our downtown communities. So that's what the idea is behind it.
There was already an announcement, though, in the summer that the Downtown Community Safety Partnership is doing this. Is this more? Is this something?
We'll work in collaboration with them. We obviously don't want to, we want to make sure we're working with them to augment what they're doing as well, and so to ensure that we're again doing whatever we can to help them do their jobs. They do incredible jobs to keep our downtown safe.
Talks about a blended public-private delivery health system, saying that it works in other provinces. Which other provinces specifically have we seen successful public-private delivery?
Pretty much every other province in Manitoba. We had 17 years here where there was very, very little to no expansion of private delivery of healthcare services in our province. And if we want to expand capacity here, it's why we're, then this is the route that we have to go to encourage the private sector to set up here in Manitoba where we can contract out with the private sector to deliver those services for Manitobans.
Why is that the route to go? Why not increase or bolster public?
Well, I think it's what's happening in other provinces and what they're able to do when we came sort of out of the pandemic and into a situation where there's surgical and diagnostic backlogs. Other provinces were able to contract out within their provinces, within the private sector. We were not able to. We were able to do some of that with Maples and Western Surgical. But now we're having to go outside of our province to deliver those services for Manitobans. So what we want to do is make sure that we're increasing that capacity here in our province.
Is there a model in another province that you're specifically looking at, like perhaps in Alberta, the UCP has endorsed an idea of increased private?
Most other provinces are doing it. If you look at other provinces, they have expanded beyond. They have a significant private sector component that they contract out to within their provinces. We have lagged behind because there was an ideological approach that was taken for decades here in our province. We're getting beyond that, and we are going to look to the private sector to help be part of the solution. Again, still within the single-payer system, but private delivery to expand the capacity within our province.
Payer, but also single tier?
Single payer, yeah. Yeah, exactly. It's the way it is now, where in other provinces they're able to contract out those services, and I think we can here as well, and some of that has been done. I just think we need more of it. We know what we've run into with our surgical and diagnostic task force. We've had to go out of province and sometimes even out of the country to deliver those services. And unfortunately, that should have been able to be done here. And in other provinces, they have more capacity to be able to keep that within their province. We want Manitobans to stay in Manitoba to get the health care that they need.
We're talking about expanded private delivery of healthcare. Are we talking about for-profit or non-profit? Because that's a big difference to the government who's paying for those services at the end of the day.
Well, competition is a good thing, I will say. And if there's more people delivering a service, you contract that out, you do an RFP for it, you go through that process. And what's important is that Manitobans get the delivery of those services when they need them. So it could be, some profit, some not-for-profit, whatever that looks like. We want to make sure that when we contract out those services, that they're able to deliver those services for Manitobans. The most important thing to us is that Manitobans get the health care that they need when they need it. And again, we want them to get it here in Manitoba.
And do you envision, like you've already touched on it, but do you envision it would be services like day surgeries and diagnostics? Like those are the things you kind of mentioned, surgical.
That's right.
So like something like day surgery and diagnosis where you wouldn't need, I'm not having open heart surgery, obviously I need to be in a hospital, but you're saying like more like those are the kinds of things you're envisioning.
Those are the kinds of things I'm envisioning, absolutely. And there's more capacity in other provinces. And we should have that capacity right here in Manitoba. And there's no reason we can't, as long as we just, let people know that we're willing to go in that direction. I think we had a couple of decades where a government wasn't willing to go in that direction, and I think we need to increase that capacity. It's not all government that has to be, the only solution to this. We need to work collaboratively with the private sector and other partners to deliver those services for Manitobans.
Do you feel it would be counterproductive a bit with the recruitment of healthcare workers that might be tended to go to private instead of staying in the public system?
No, I think, obviously what we're concerned about, and that we did announce a $200 million investment in our healthcare resources and 2,000 more healthcare professionals in the province of Manitoba just last week. We're very committed to that. But what we don't have is the capacity within our province right now to be able to deliver those services all right now. I think once we recruit those individuals, we'll have more greater capacity within the province. But I think as well, in the meantime, it would be good, rather than contracting out, for these services in other provinces and other countries, it would be great if we could do that, more of that right here at home. So it's a balanced approach to it.
What kind of revenue sharing are you envisioning with Indigenous communities for, as it's called here, economic reconciliation? What kind of, like hydro, like, I don't know, what are you envisioning there?
Really, if we look at the mining sector, for example, there are lots of opportunities, companies that are looking to invest here in Manitoba. And what I think is absolutely fantastic is before they even come to government, they're bringing with them Indigenous community partners. And to me, that's real reconciliation and economic reconciliation with Indigenous peoples. And to me, that's really exciting. I think there's a lot of hope and opportunity for Indigenous communities in our province if they are part of that, the revenue sharing.
Just going back to healthcare for a second, the single-tier system, that's what you're envisioning. Would Manitobans face any potential fees for any medical services as a result of this, do you think?
I think expanding right now, Carol, we are contracting out services to other provinces and to the United States. People are not paying for those services. The government is paying for those services. So what I'd like to do is just, rather than paying another country or another province to deliver those services, it would be great to be able to offer those services here in Manitoba. Again, still within a single-payer system.
No fees for service for any...
No, they don't pay for that now, and we wouldn't expect them to pay for that moving forward. Again, it's expanding and taking, and utilizing sort of a partnership with the private sector to help deliver these services that are needed for Manitobans.
There's talk here of post-secondary institutions about equitable funding, about considering all proposals that they have to address the labor shortage. There's no specific notice that I see about tailoring funding to performance. Are you pulling back on that this year, or is the plan still to go ahead?
I think, especially through COVID, it's been challenging for some of our post-secondary institutions. And I think we need to take a bit of a step back, look at those institutions and say, what is going to keep them going right now? So there's been some challenges, I think. And so we have, this has come as a result of us reaching out and having those discussions with them. And so we want to continue to have those discussions. So really what that looks like moving forward, I'm going to leave that to the minister to work with those in the post-secondary field. Obviously, what we want to do is tailor more of our post-secondary institutions towards what is needed in the job opportunities here in Manitoba. So I think you can see more of that coming forward in terms of the training training side of things. And, we know that there's a labor shortage across the country, not just here in Manitoba, but we'll look at more innovative ways, not just on the post-secondary side, but looking at immigration, for example, as to how we can help solve some of the labor challenges that we're facing here.
But I see that. I just want to make sure I'm getting that this is a step back from the performance funding proposal.
Yeah, I think what it is for right now, I'm always, in favor of performance measures, but I think, through COVID, as we've come through COVID, there's been some challenges, and with the labor shortage out there, we need to ensure that we are training our kids for jobs of the future in Manitoba. So we'll continue to move in that direction, and perhaps look at providing incentives for people that want to get into certain areas. And we talked about that a little bit in the healthcare area, where we made our $200 million announcement last week just in the healthcare field. But it goes beyond that. The private sector is in need of labor as well, and it goes right across our province in terms of labor shortage.
It says here, to continue to work with the City of Winnipeg as they develop their transportation master plan. Mayor Gillingham wants to, no secret, expand Kenaston and extend Chief Peguis Trail. I don't know if that's part of what's being referenced here or not, because it's just, it's pretty vague, but what do you think of those two projects?
I think what it is what we're trying, it's a continuation of taking a collaborative approach to how we do things when it comes to transportation in the city of Winnipeg and beyond, frankly, in other municipalities as well. And I think, I've proven in the past, and we have as a government, we've proven to work collaboratively. When we do with other levels of government, we actually get things done. So things like the North End Wastewater Treatment Facility, the buses, these are all examples of things that when we work together, we can actually get things done. So that's really just a commitment as well to work collaboratively when it comes to transit, to see how we can help out there as well.
Time for a few more folks.
Resources through Churchill, mentions resources through Churchill. Does that include oil?
So we are looking at liquefied natural gas as primarily what we're looking at. And I would say there's lots of opportunities. Businesses are very open to this. We know that with the energy challenges in Europe, with the horrible situation that's happening over there, shortage of food potentially as well, that Manitoba is well positioned with the Port of Churchill to be able to look at what that would mean in the long term for our province. And we're obviously looking at and working collaboratively with, and there's interest on the part of Saskatchewan and Alberta, but the discussions have been about liquefied natural gas.
Just about immigration, it's going to be a key component where are all the newcomers going to live, I guess, is the question. If immigration is a key component to the province's economic recovery, that's a question that the Chamber's been asking. Manitoba used to be a big draw because it was an affordable place to live. Not so much anymore. What's going to incent the creation of, new affordable housing?
Well, I still think, affordability is a big challenge across the country. I think relative to other provinces like Toronto, if you look at Toronto or Vancouver, Montreal, these places, even Calgary, they're much more expensive to live still than Winnipeg. And obviously we need to, when it comes to housing, look at working collaboratively with the federal government at building, new housing as well, but also looking at the private sector as well and getting them involved as well. And we had a good example of working closely with the private sector and the federal government as well as us. And I think, where we can build more of those housing units. And I think also there's great opportunities. I've had very good discussions with President Chartrand in the Red River Métis, and I think there's good opportunities there to partner with them as well on housing moving forward. So I think, stay tuned, lots of exciting things coming that are on the horizon where I think if we work together, we'll get some of these things done.
So a lot of the things in the throne speech here more, look towards the long term. There's going to be the provincial election next fall. What can Manitobans expect to see happen in the short term that's going to help them with inflation and affordability, within the next 12 months?
Yeah, you'll see quite a bit when it comes to affordability, safety in our communities. All of these areas that have been outlined in the throne speech, we'll see announcements being made in the weeks and months ahead. This is the outline for the next year and the vision for the next year. Many of it is still long-term as well, absolutely, when you look at the Port of Churchill and other areas as well. I mean, housing, these are long-term development issues, but there will also be some short-term, especially in the area of affordability, that you will see in the weeks and months ahead.
Last one here. On the addictions treatment spaces, there's 1,000 new spaces that government's committing to.
Yeah, it's almost you know what, we'll have to get the details of that. I mean, it will be rolled out over the course of the next little while, but those will primarily, for the most part, be new spaces. We know that they're needed, and so we're committed to that, but working collaboratively with our partners in that community to ensure that, to see how that rolls out. So again, there'll be more details as to what that will look like.
In terms of how long, or
As soon as possible.
How will you increase waste diversion and recycling?
Working collaboratively with, okay, this is it, Jeff. Working collaboratively with municipalities, I think we can do better when it comes to recycling and waste management. And I think, it's certainly something I'm looking forward to sitting down with Mayor Gillingham for the city of Winnipeg, but also for other municipalities across the province. I think there's lots of opportunities. We're hearing from young people that they want to see more of this from us. I agree with them, and that's why they will see more of that coming forward.
Organics, will you have an organics program?
Possibly. We'll see what that looks like. Thanks, everyone. Have a great day.